Greetings and welcome to another episode of Gaming for You with me, Dr. Terrence Drew. I want to really thank you for the number of suggestions that you have made on my Facebook page. And one of the suggestions was that I speak about blood clots. So what are blood clots? Blood clots are clots formed by the blood in the blood vessel. They can happen almost anywhere in the body. But specifically I want to speak about blood clots that occur in the lower extremities or the legs, which are very common. So what causes them to form? We know that there has to be a number of conditions such as slow blood flow, thickened blood, or damage to the wall of the artery or vein or the blood vessel. And these clots then would form. But what predisposes a person to have blood clots? In other words, what are the risk factors? 1, being obese. 2, taking certain types of medication that thicken the blood. 3, being in a position for a long time, such as being bedridden. 4, after surgeries of the hip, of the knee, or major surgery and being in bed. Having certain type of diseases such as lupus or autoimmune diseases can really predispose one to developing these blood clots. But we see them very commonly in women in their fertile years, much more common than in men. And we know that birth control pills can help lead to blood clots. So what are the common symptoms of blood clots? Once it is formed in the leg becomes swollen, can become red and painful fundamentally. And that blood clot in the leg can then travel up to the lung. And when it gets to the lung, it can cause chest pain, shortness of breath, tiredness, or even sudden death. And so it is important that it is identified. How do you diagnose it? Fundamentally in the leg by way of a blood test that can be done, that is called a D-dimer, and a Doppler ultrasound. You can also do what is called a venography, but that is very invasive. But with a blood test and a Doppler ultrasound of the lower extremities, it can be identified. What if it travels up to the lung? How can you detect it? You can do what is called a VQ scan. But fundamentally here, we tend to use CT scans of the chest with contrast. And so once identified, has to be treated. And how are they treated? Was there deep vein thrombosis, or they would have gone to the lung with blood thinners. And you have different types of blood thinners that are with some that you inject, some that you take by way by mouth or in a pill form, and there's some newer ones that are actually in pill forms. But in the old days we used to use what was called warfarin or coumadin. But this type of medication was very inconvenient, as persons had to take blood tests every month to see how thin or thick the blood was, to really judge how effective the medication is. Additionally, they had to be on a special diet called a low vitamin K diet, which excluded green and leafy vegetables, which was very inconvenient for many persons. But with new medication like Pradaxa and Xarelto, those that we see being advertised on TV, they don't carry regular blood tests, nor do you have to be on any special diet. And so your doctor will determine when you start your medication and when you should stop your medication. But with this information, now you are armed with the necessary army, so to speak, to protect you, your family, and your community. So I really want to thank you for joining me, Dr. Terrence Drew, in discussing blood clots on this episode of Caring for You. Thank you.